just takes, from Mahabharata, from Ramayana, and he says everybody who has tried to do good has been in trouble. Okay, because it's not only now, for generations it has been, for eons it has been like that, that somebody tries to do good and he'll get into trouble. Okay, Sita did all that she could, but still she was suspected in the end. Was she really faithful? So somebody who does good, it's very difficult for them to persist, and that is where the challenge is. Swami says they're all tests for you. After all, everybody is looking for a change in India, isn't it? People are fed up with everybody being corrupt and so on. So if they see somebody who is, of course in the short term they will be, not only in the short term, even in the long term you'll have a problem. Because if you are trying to do good in society, everybody including avatars who have tried to do good have been criticized, So unnecessarily, for nothing that they have done, people criticize. That is human nature. But ultimately, as Swami says, truth will prevail. Again, going back to Mahabharata, Draupadi, he comes, but he comes a little late, because she's calling to Krishna who is far away. He says, I am in your heart. If you had only called Krishna here, from my heart come, I would have come running to you. You prayed to other Krishna who is far away, so I had to come all the way. So it took me some time to come, So these are all instances which teach you that omnipresent, he is always there, but he is also waiting for you to call him. You take the first step, I'll take 100 steps. He never said, you don't take any step, I'll take all the steps towards you. He has also put a condition, you take the first step. That first step you take, I'll take 100 steps towards you. I think that is what we have to keep in mind.
We have faced, whenever we speak to youngsters, especially whenever anyone tells them that, when you go out in society, you have to be ethical, you have to follow these principles. People listen, youngsters listen. But they say, it's not really going to be so practical. The world outside is so different. You can't really make it big if you want to strictly follow all these principles. Some things are good only for the books.
Yeah.
Now, what is your take on that? You've been so successful in your life. You received Padma Shri from the president's hands. What would you like to say to this generation? Can you share something that you have experienced in your life from your own personal experience?
Yeah, I'll give you an example. Partly their fears are justified. Because, Swami says, he himself says, you come to Prashanti Nilayam, you are here for a week, it's a different world, so you have so many ideals you think about, like a New Year resolutions, okay, you do everything. Yes. Then you step out onto that bus outside, and the moment you get in, you see the world is different, the whole world is different. So the world out there is a little different. But that doesn't mean that we should not try and that we should not, that we should give up and that nothing is possible, okay. We have to persist with what you think is right. And in fact, there is a book now called The Difficulty in Being Good by Gurucharan Das. Yes. So he just takes, from Mahabharata, from Ramayana, and he says everybody who has tried to do good has been in trouble. Okay, because it's not only now, for generations it has been, for eons it has been like that, that somebody tries to do good and he'll get into trouble. Okay, Sita did all that she could, but still she was suspected in the end. Was she really faithful? So somebody who does good, it's very difficult for them to persist, and that is where the challenge is. Swami says they're all tests for you, and each test you pass, you come higher and higher in how I assess you. And if you're going to get something very easily, it's not worth getting that degree at all. Okay, so those are the tests in life where we have to take a call. So we were in, we stepped out of Tamil Nadu and came to Hyderabad and set up our, our branch there. So initially we were doing very badly and very slowly it was becoming different. They don't know us as well as in Tamil Nadu. To the first foray into another state, Andhra Pradesh, and the culture there was slightly different. Okay.
Another institution of
branches. Yeah, one of our 16 branches. Now we have 16, and the first one is in Muscat, just coming up with Swami's grace. But outside Tamil Nadu, the first one was in Hyderabad. So we started this. So we had a training program. Okay. So this training program is purely voluntary. The doctors come in over a period of few days, train them in diabetes. They don't pay anything. It's free, and I'm offering all that I have learned to them as and these are private practitioners. They're not even diabetologists. They're general practitioners who do lots of other things, and they have diabetes. So after everything was over, after certificate is also given to them, they've been trained, and everything that we had to teach them, we have taught them and all that. And they're going to go back and do general practice even then. I just made a casual comment saying that Now that I have taught you, you will be able to treat diabetes well, but you might have some difficult case which you are not able to handle, and if anything is there, we are always there at your service. Okay, I did not even solicit, I did not even say refer to us. I just said if you need any help, we are always there. If some high end equipment, somebody has some eye problem, kidney problem, something like that, you can refer to us, if you want to. It is up to you if you want to refer. Straight away the doctors are telling me, after getting everything from me free of cost, okay, and getting the benefit of being educated and all the material given to them, everything given free of cost for weeks together, all the knowledge being imparted, they tell me directly, how much kickback will you give us? So, for a moment I was taken aback, and I said, what? They said the going rate is 20% in Hyderabad. So, if you give us anything more, 25, 30, we will refer to you. So, I said, I am sorry, we have never done it in our life, and I will not be able to give you any kickback at all, because I have not done this so far, and I do not think I can do it, because first of all our rules do not permit it, and my ethics do not permit it. I am a Sai devotee, I can't do it, and the way our institution works, we have never done like that. So, I will not be able to give any kickbacks to you. Then they said, we will not refer a single patient to you. I said, so be it, I am willing to close down the Hyderabad center, okay, if necessary, but I will not give you kickbacks in order to work. So, it almost came to a crisis, and I came here and I prayed to Swami and so on. And I remember it was in December of 1 year, it's 2.5 years had passed, going in loss. And I called my Hyderabad person, Dr. Shastri, who now works with me for 24 years now, and he worked with me first 14-15 years, then only I sent him to Hyderabad. Now he's been there about 8 years now. So I called him and I said, shall we consider, we'll give it another 2-3 months time obviously, and if it's not, it's still going loss, how long I can, keep going in loss? Why don't you come back to Chennai? We'll continue. Chennai is doing well, we'll come back to Chennai. He said, sir, whatever you decide, we will do that, but no giving kickbacks, okay, we will not do that. If necessary, we'll close down the center. Miraculously, this is a pure miracle of Swami, and that's where, see, he's been testing. Will he do it, will he not do it? That's where the test comes. So, after that, from January, a sudden influx of patients, I don't know from where, suddenly it came, and the rest is history. Hyderabad became one of our good branches. Wow. It's one of our success stories now, What happened between January and December and January? Nothing. We did nothing special. We did no advertising. We did no kickbacks. We did nothing. We continued as is where is. Suddenly it changed. Suddenly the divine grace came, okay. It must have been a test saying, will they give in to this or not give in to this? And when we said no and surrendered to Swami, he then took over and then he made it a success. So, I think if you stick to your principles, in the short term you may lose something, but in the long term, what you get out of it, the respect you get out of it, people will come to you. After all, everybody is looking for a change in India, isn't it? People are looking for, people are fed up with everybody being corrupt and so on. So, if they see somebody who is, of course, in the short term they will be, not only in the short term, even in the long term you will have a problem, because if you are trying to do good in society, everybody including avatars who have tried to do good have been criticized, So, unnecessarily for nothing that they have done, people criticize. That is human nature. But ultimately, as Swami says, truth will prevail. Ultimately, goodness will prevail. There has been no instance in history where only evil prevailed. You take the entire Puranas and everything, ultimately the good only prevailed. But look at all the good that people tried to do. Yudhishthira, you take anybody, they would have gone through so much of suffering, And the most purest man gambles, loses. Why should he gamble? Why should he lose? He is meant to do that. He is meant to go through that suffering, And then he is meant to go through that purification process. So, that is how I think we will have to. So, I would tell youngsters, don't worry. Stick to your principles. Do what you think is right. If one door closes, another door will open. It cannot be that the whole of history is wrong, that the whole of all the teachings that Swami has taught us, the various avatars in the past have taught us, are all wrong. So, if you stick to what you believe is correct and you stick to that, you will be able to do that. I am not saying that little bit of here and there, it may not be there. You might have to please somebody, you might in life you have to, for example, whatever we think we cannot tell, no, in life. Yes. Truthful. So, now right now I think something bad about you. Can I say it straight away? You cannot. So, certain things you have to play in diplomacy. Lately the talk may go away. So, life is like that. I think we have to go along. We cannot go along one straight path like that. There could be things, but by and large, stick to the principles and pray. That's the other thing I would say. When you have a difficult situation, surrender. Surrender to Swami and say, that's it, I can't do anything. And I'd like to talk about one or two medical miracles which have happened like that. If ethical miracles are there, there are also medical miracles also which happen.
Really,
So,
it would be very nice if you can share about how you're able to feel Bhagwan's presence actually in your profession. In fact,
private in the practice, yeah.
in the practice,
Yeah.
because as you mentioned, ultimately truth will prevail.
Yeah.
But if you look at Mahabharata or any other instance also, what is also true is during this entire test, God is with.
He's with you.
He's with,
With you, with
actually.
you, with you, yeah.
In the Mahabharata, it was so obvious.
Yes.
Krishna was with the Pandavas.
Yes.
I think if you look at all this history also,
Yeah.
God was always with them.
Yes.
So it's only a question of we feeling the presence.
Exactly,
So
exactly.
if you can share, how
Yeah.
you.
See, we treat as a normal doctor. If somebody came to me as a patient, I will normally treat, as a patient, and I will continue to treat. After praying to Swami every single morning, we pray to Swami that give me the courage, give me the wisdom to do what is right and help my patients, and I am only an instrument, and through me you treat, you heal. I am only doing the the external thing of giving a medicine or giving an advice. It's you who is healing. So that, of course, every single day it goes. At the end of the day, we thank him for all that he has done. That goes without saying. But sometimes the best of doctors are stumped. They just don't know what to do. I've told this in front of Swami in 2008 in a speech, but I'd like to just repeat it here. There was a Muslim gentleman who came, and he had undergone a surgery, small anal surgery he had undergone, and he had a very low pain threshold. He cannot stand any pain, the least of pain, and this is a very painful area. So he had been undergone a surgery there, and the first night after that operation, he didn't sleep at all. He had intense pain. So finally, we had to give him Fortwin and then Pethidine. These are the narcotic drugs which you normally give as a last resort. I gave him that also. But
Painkillers.
Painkillers. Narcotic painkillers they are called. Okay. If you give them for long enough, they'll get addicted to that, So I gave it to him. I said, he needs a pain. He's shouting with pain. We gave him that. He didn't sleep. The whole night with that also, he didn't sleep. So next morning, evening, I had gone somewhere. Then I knew this man is, in trouble. So I went back to do rounds. Around 8:30 in the night, I went back to do rounds. And the moment I went to his room, he caught my hand. And he said, doctor, do something, do something, do something. I'm having pain, do something. So I said, look, I have given you, yesterday the strongest of medicines I've given you. There's nothing stronger than that I can think of, for pain. So I'll probably repeat it today. No. You must do something for me. Relieve the pain. I don't care what you do. I cannot go through one more night of pain. I'm suffering, doctor. I'm suffering. Pain. So my heart melted. I don't know what to do. I told him, close your eyes. He closed his eyes and he was sitting on the bed. So I have this ring, Swami's ring. So I just prayed to Swami and put the ring on his head and said, I just silent prayer to Swami. I said, Swami, I don't know what to do. This fellow, I've given him everything and I'm just not able to, control his pain. You are all merciful. You are all loving, and this man needs his help. So I am praying to you to relieve him of his pain. Irrespective of what medicine I give, I don't think that's going to have the thing. It is you who is going to relieve his pain. I pray to you for this pain, and I surrender at your lotus feet because I can't. That's it. As a doctor, I'm stumped. Now I surrender to you. At the end of my thing, I have to come to you only. So you look after about 1 minute, 2 minutes. Then I told him, okay, now you open your eyes, okay, you will be fine. I said, before he asked me a question, I walked out of the room, okay. As I was walking, the sister came, the nurse came. He said, today what I'll give him? Repeat the same, what else is there? I don't know of anything. I can give morphine instead of pethidine, it makes not much of a difference. So I said, you give this combination, I think we will give. I said, what time I'll give? Around 9:30 you go in the night, so he'll sleep for some time. I hope this time he sleeps. So you give him that, I said, and I walked out. Sister went at 9:30 to his room. The man is fast asleep. Okay, nothing has been given to him. Not even a crocin was given to him. He is knocked out and he's sleeping, snoring, sound sleep. So she called me and she said, he's sleeping soundly now. What shall I do? I said, don't give it, because if you go and poke him now, he'll wake up. Maybe in the night he'll get up. That time you give it him. Okay, so at least some hours he slept. Then you give him this poke. Then few more hours. Then tonight at least we have gone through. She kept going back every 2 hours. Fellow is fast asleep. Okay. And then 7:30 in the morning he gets up and he says, no pain, nothing, all gone, I'm fine, you know. Then he called the sister and said, what did you give me yesterday? Because he said previous day you gave pethidine, fortwin, something. So yesterday what did you give? Then she said, I didn't give you anything, you know. Then he said, what do you mean you never gave me anything? Sir, you slept off, sir. So I didn't. Then doctor said not to give you injection. How did I sleep? I said, I don't know, sir. You slept off and so this thing. I said, no, I'll wait for Dr. Mohan to come. Then I entered his room for rounds. He caught my hand again. Doctor, what did you do to me? I said, what did I do to you? Then he said, no, my pain is gone. I said, no, be happy. If your pain is gone, be happy, you know. He said, no, you did something. You made me close my eyes. And then you did something on my head you put. Then after that you went off and then I just slept off. What did you do? I just want to know what you did. I said, what does it matter what I did? Okay. You have got relief and that's what you wanted. You have got it. There ends the story. Finished. Let's not go further. Because I didn't want to talk to a Muslim gentleman about Swami and this and that. I'm a little delicate to how to explain it to him, you know. They don't accept somebody in human form as a god, you know. So only the formless God, only Allah. So I was a little delicate, embarrassed to tell him that. And in retrospect, I should not have been embarrassed. I should have told him straight away. But Swami taught me that. The next minute he taught me that. He said, I insist that I know what you did to me. Then I said, okay, if you really want to know, you know, this ring of Swami is there. I put it on your head and I prayed to Swami to relieve your pain. And that's it. I didn't do anything else. That's all I did. Next sentence he tells me, your Baba is God. Your Baba is God, doctor. Only God can do that. No human being can do that. You have prayed to him and he has relieved it. That means your Baba is God. And he said, you're so lucky, doctor. You're able to see a human God, God in human form. And you're able to go to Puttaparthi. Next time you go there, please pray for me. So it so happened that after some time when I came here, actually I could talk to, you know, I could relate this in one of the speeches which Swami made me give. I mentioned, I took Swami's permission. Can I talk about it? He said yes. So I talked about it. Then I taken his permission also. Anytime I get, can I talk about it? Oh, please, please tell, please tell. So I told him that in front of Swami, I spoke about it. He said, I'm so blessed that Swami actually heard about me, you know, about it. I wish I could come to Puttaparthi and be there. Then he said, you know, in my circles, if I come, he's a very well-known man. I'll be noted immediately. So I pray, but I don't want to come there right now. I'm not yet ready to come there. But you know, you are blessed. You are able to go. Please pray for me every time you go there and all that he says. So here is an example of where Swami's grace saves somebody, okay, from pain and from anything. I know cancers which have been cured, a lady who had cancer completely cured by Swami, the cancer, just cancelled the cancer. This pain thing, my mother went through a similar thing. She had undergone a surgery, a hip replacement surgery. She was very bad asthmatic. She's still there, quite old, but she has, I mean, from young age she had asthma. And because this asthma, giving her anesthesia is a bit of a problem. So they had to give her an epidural. At the back they put in like spinal. They put in a tube and then continuously the pain, because very severe pain. Hip surgery, she even underwent a hip replacement, which means you cut the hip, take out the bone and put in a steel one. So you can't, such a big bone if you cut, you can imagine how the pain will be, you know, and you're replacing it with a steel one. That's what is called a hip replacement, you know. So she had undergone a hip replacement that night and I was staying with her in the hospital and she was fine until around 2 o'clock, 3 o'clock in the morning, around 3 o'clock I think in the morning. Suddenly she started shouting, you know, saying that, oh Mohan, it's paining, 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 paining. She started crying. Then we called the doctor and had a look. That tube has slipped out. The one which is put inside, that is slipped out. Now there's no way you can put it back because that needs an anesthetist, number one. Number two, before surgery we could bend her, and now she's already undergone surgery and one hip has been replaced. How can you bend her again and put it back? It's not possible, you know. So I don't know what to do. It's completely stuck. I don't know what to do. She's crying in pain. There at that hospital, I knelt down to Swami and I said, Swami, I'm stuck, you know, just don't know what to do. She's in pain, Swami. this is the time when, you have to come. Only divine intervention can help at this stage. So I'm praying to you, Swami, she needs help. So please help her now, Swami, and relieve her of the pain. I cannot hear this. How shouting in pain, how can I sit by her? And I don't know what to do now. One injection and all is not going to, how long? After the 4 hours again it's going to come. Hip replacement, So I just took vibhuti. I had vibhuti there, put vibhuti in her mouth and put little vibhuti on her forehead and just said, Mummy, you will be fine. In 2-3 minutes time she just slept off. Nothing was given. Lady who was shouting in pain, 2-3 minutes later she's just finished. Swami's grace has come. No medicines, nothing for pain, See, if you say, I'm not only a doctor, I'm also a scientist. So sometimes when I say this, of course devotees, when they hear that, they'll say yes. But sometimes when I say this, the medical profession, they'll say, Dr. Mohan, have you gone out of your head? How is it possible? How is it possible? You are saying that just you put a little vibhuti in her mouth and then the pain went away. I said, you are saying it's not possible because you're thinking from the human level. You're forgetting for a moment that there is something above us. There is something called divine, and that God is omnipotent. He's omnipresent, so He can hear that moment. He's omniscient, He knows everything, and He's omnipotent. There's nothing He cannot do. If He can create a whole universe, a whole galaxy, a whole universe, somebody's pain He cannot relieve, So you are underestimating God, You're not giving enough credit to God. You're not believing in God. That is what is. We are only praying to Him, not that we are only praying to Him, we always pray to Him, but in special situations like this, we are desperate and we are completely surrendering to Him. At that Sharanagata way, just going and saying, now there's nothing more but you, we are saying. You think the Lord will not listen to you at that time? Okay? Tennyson says, Alfred Lord Tennyson says, more things are wrought by prayer than this world ever dreams of. Mahatma Gandhi has said that I have never known an instance in my life when God has not answered my prayers. Every single time it will come. Okay? Then people will say, oh, you're saying all this. That means there are so many instances where prayers have not been answered. So what do you say for that? Atheists say that. So many people have prayed for something. If it has not happened, it's for a good reason it has not happened. It is not meant to happen. If it has happened, it's worse for you. And that is why it has not happened. Okay? If you have full faith in it, and if you surrender, and then if you pray with all your heart, Swami says, my heart is like butter, but it still needs some warmth to melt that butter. Melt it. So that is that warmth that you're talking about. That is an intense faith that you're talking about. That is that warmth that you must build up when you really pray to Him.
You have to call
if you do that, you have to really call Him from the bottom of your heart. If you do that, I have not seen a single instance when Swami has not responded. Swami will always, always, always respond. And as a medical doctor or as a scientist or as anything, it is that surrendering which is the most important point. Sometimes I think He brings these tests to test you. Will you think of me, And when will you think of me? Again, going back to Mahabharata, Draupadi, he comes, but he comes a little late, because she's calling to Krishna who is far away.
Yes.
He says, I am in your heart. If you had only called Krishna here, from my heart come, I would have come running to you. You prayed to other Krishna who is far away. So I had to come all the way. Yes. So it took me some time to come, Yes. So these are all instances which teach you that omnipresent, He is always there. But He is also waiting for you to call Him. Yes. You take the first step, I'll take 100 steps. He never said, you don't take any step, I'll take all the steps towards you.
Yes.
He has also put a condition. You take the first step. Yes. That first step you take, I'll take 100 steps towards you. Yes. I think that is what we have to keep in mind. And it's very humbling because we may think we are big doctors, big lawyers, big this thing. And I think these are all humbling experiences because they teach you that ultimately there is something beyond us. And ultimately somebody else is curing. So when somebody gets better, we say, we cured him and so on. Next instance, we'll know that we were wrong. One of my ENT surgeons, who's my classmate, used to say that he'll have two patients. One will be a young person who in a very early stage of disease it has been detected, two cancers, very early stage and you have to remove the entire tumor, okay? And he'll say that you are completely cured. Next 20 years, no problem for you, okay? The other will be an older person who has a little more advanced disease, so he could not even do the full treatment for the person. So he'll tell them very guarded prognosis, maximum 6 months, 1 year. 10 years later, that fellow will be still alive. This fellow, some recurrence would have come within 6 months and he would have died within 6 months to 1 year. So he says, as a medical doctor, with all the knowledge that we have, of course, we are able to, I am not saying you cannot prognosticate. I am not saying there is no medical science, you can't say this will do well, that will do well. In general, you can get it done. Statistics, if you take 80% this will happen, 20% that will happen, all that is true. If you do science properly, you will be able to show. But in a given individual, can you say that? You will be all right, you will not be all right. Can we say that? No, we cannot say that, because that God decides. That person's fate is decided by God. In general, you can say, you do this treatment, 80% do well. You do this treatment, 60% will do well. What about 40%? What about 20%? There's always something there. So, every time we submit and we say, well, I have done what I have to do, now you pray. And it's your karma, what you have to get from God, that part. But I have done my job. We have done what we can do. Okay. Now you pray to the Almighty, and He will do the best for you.
Surgeon only cuts, God heals.
God heals. Absolutely
as they
right.
say.